since we're back.
Alrighty. Hi everyone and welcome back. As you all know, today we're going to be talking about something important, dental health. It's something that matters to all of us. My name is Shai and I'm excited to be your host for this live show. We've got a great show lined up and we'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. It'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone. And now let's welcome Dr. V and start our show.
Thank you, ma'am. Thank you very much. Hi, everyone. We apologize for the technical difficulty. I'm sorry we are delayed. As you guys know, I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm so excited to be here with you all today. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and American Board of Periodontology. Just this a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialist, and we have 4 offices in the Dallas-Fort Worth area in Texas. We are all about making sure your teeth and gums are healthy and strong. Now I'm here for you, and I would love to hear any questions you might have about your teeth and gums. You can ask us questions live here right now, or even send them in for our next show. Your questions help us make these shows really helpful for not just for you, for everyone. And one more thing, if you like what you're learning here, please let us know. Your feedback is super important to us. And don't forget to like and subscribe to our channel so you won't miss out on our latest updates and helpful tips for your dental health. I'm looking forward to talking with you and answering questions, and let's make sure our smiles are the best they can be. Let's get started.
All right, here we go. First question. Hi, doctor. Recently, there was a viral news about Kanye West's enlarged lip due to a titanium denture. What exactly happened? How does this happen to everyone? And how did it occur? And how can we prevent it from happening to us?
So titanium, as you guys might know, it is a metal. So anybody can get any type of allergies. You guys hear about any type of food allergies, or which is nut allergies, one of the most common thing that exactly possibly happened in his case. He probably got allergic to the metal, which is the titanium metal. Speaking of that, how can you prevent that? So one of the things that you're going to see or hear in the dental offices, and when you need to have a tooth replacement, you need to have dental implants to replace those teeth, and those dental implants are made of titanium. Is it possible that you can get allergic to this titanium metal? It's very possible, but there are the titanium allergy is like very rare. And if you're truly concerned that you may be allergic to titanium, and that is very possible that the various ways possible that we can do some titanium allergy test, so we can make sure that you're not going to be allergic to that metal. And there are other ways that we can treat also, not just the titanium implants we place, and we place some ceramic implants, which means if you're allergic to that material titanium, there are some alternative products or the replacement dental implants available for titanium dental implants. So the best thing to do is to not to be concerned. Talk to your dentist, and they will be happy to help you.
Absolutely. Perfect. So when there's a will, there's a way.
Absolutely.
All right. So, doc, I have dental implants in my front teeth, but it's not aligned with my natural teeth. Are implants pre-made, or are they customized based on the patient's jaw size? Is it possible to receive the wrong implant size, causing the crown to protrude slightly compared to the natural teeth?
Great question. You probably may be paying attention to details, and so implants have several components to them. When we talk about implants are implant teeth. So the implants have like a base, which is an implant metal post that goes into the jawbone. This is an implant, by the way, here. Don't know how much you guys can see. This is an implant metal that goes into the jawbone, the base bone. And then after that, we also get like a connection that goes on the top of the implant, and then goes the crown. So implant comes in 3 parts. The one that goes inside the bone, you don't have to really custom make it, because the implant that goes underneath the bone, so you really don't need to do that. But to make it specific, either we call it as a custom or we call it as a patient specific. So what we do is, after the implant metal device is inserted into the bone, and once it heals, then we take measurements of that implant, and then we make what we call it as a custom abutment or a patient specific abutment that also holds the crown on the top of that, which can be fitted on the implant so it looks natural. So to answer your question on why it is protruding, that part I really can't tell. So without looking, of course, in your mouth, and I really can't tell without doing some special investigation such as x-rays or CT scans, I can't really tell what your specific situation is. But the best answer would be to talk to your dentist and see what exactly is going on and why there is like possibly like a discrepancy in the tooth size or the tooth protruding, and they will be able to answer.
Perfect. Let's keep the fun rolling. Dr. V, last night I was using my water pick and my gums above one tooth started hurting. When I checked, there were bleeding. The pain continued afterwards, but I ignored it and went to bed. This morning I woke up and the tooth hurts. What could be the cause?
So whenever you have the gums that are hurting, and it is very possible it is happening due to a variety of reasons. It is very possible you have a lot of tartar around the gum line, or you have extensive bone loss around the gum line and around the tooth. And also you may have periodontal disease or extensive bone loss that could be causing the pain. And also very possible you may have an infection, what we call it as an abscess around the tooth. So you may have some pain just around the gum line to begin with, and when you reach like a certain threshold, now it is the infection or whatever that you have going on, the bone loss that you have surrounding just the gum, what you think it is the gum, could be going all the way down into the root surface, and which is the reason why the tooth may be starting to hurt. Again, without looking at your mouth, I can't really tell you, although you may think that there is a little bit of infection around the gum and a little bit of a bleeding, and that little bit that you think are just the bleeding that you have noticed, and could that be a cause for a real concern? Absolutely, it could be a serious concern, because you don't want to leave any type of infection. If it is treatable at this point, you definitely want to try and see whether you can salvage the tooth. And the most important thing is you don't want to have this infection get into the bloodstream and pass on to the rest of the body. Then, if the infection becomes really serious or you start really hurting, you may end up even being in the emergency room. So you don't want to do all of that. The best advice would be to just check with your dentist, and they are able to look at your mouth and then do some special x-rays and CT scans to tell you what exactly is going on and give you the best treatment option.
Perfect. If you're local, come see us.
Absolutely, yes.
Okay, so it's time for a game. You ready? Alrighty. So, we're going to play rapid fire questions, and Dr. V is to answer singular questions within 1 to 2 sentences or less than 30 seconds.
Okay, we try, man.
Let's go.
Okay.
Being a periodontist, if you could give just one essential gum care tip, what would it be?
Brush and floss your teeth. So a lot of people say, can I just brush and floss once a week? No, brush and floss every day.
Please.
Twice a day, actually.
Twice a day.
Yeah, perfect.
That's right. Please.
Yeah.
All right. One of my front teeth looks slightly reddish. What could be the possible reason?
It could be a variety of reasons. It could be gingivitis or gum disease, or it could be a fractured tooth, a variety of reasons. Best answer is to go and see your dentist.
That's right. Does toothpaste affect good bacteria in the mouth?
It does to a certain degree, but not to the degree that you need to be concerned. Just do it. Just brush your teeth and it's always good.
Yes, please brush your teeth.
Okay?
All right. Perfect. So that was fun. I think you did it.
Thank
That's
you.
probably the quickest round we've had.
Okay.
All right. Hi, doctor. Is laser gum therapy typically completed in multiple sessions? Are there any maintenance laser therapy sessions required afterwards? If so, how many would typically be necessary following the initial treatment?
Fantastic question about the laser gum therapy, and many of our patients have the same and similar type of question. So whenever you do the laser gum treatment, most of the time it may be just a one-off deal, but sometimes it's kind of like, we got to go back and correct, like if we treat the whole mouth, for example. Sometimes people, when they have infection around all the 28 teeth, we go back and treat the infection around all the 28 teeth. And do we have to go back and correct some 1 or 2 teeth which may be reinfection, or the infection completely not resolving, or the bone that is supposed to form around the tooth that is not like completely come back yet? So we definitely need to use the laser to go back and retouch it. That's number one. Number two, there is always, what we call it as a maintenance laser. So for example, when you have really infected gum tissue, either you're going to get what we call it as a deep cleaning or a deep gum therapy, followed by the laser adjunctive therapy. That's what we do in most of our offices. Most of the time it is called laser decontamination or laser bacterial reduction. And sometimes we do gum surgery, which is commonly called as osseous surgery. When you have advanced gum disease and there is a lot of bone loss, we use the laser to open up the gum tissue and pass the laser to clean the bone and also make the bone come back, what we call it as a regeneration. You can look it up on the internet, like there are two procedures that are called LANAP, LANAP, or a repair, like a REPAIR, repair. We use in our offices, we use two kinds of lasers, and you can look it up. So after you get these type of laser gum surgery, every time you got to come back, which is the 3 months maintenance cleaning. We call it the periodontal cleaning. When you come back, we always do the LBR, which is the laser bacterial reduction, to go around the gum line to reduce the bacteria to maintain or improve the healing. So to answer your question, the bigger laser treatment is mostly one time. We may have to go back and retouch it, or after the bigger laser treatment, when you come back, we will do like more of a mini laser cleaning, what we call it, and we go and clean around the gum tissue.
All right.
Okay, great.
Absolutely. Let's keep it going. Hi, doctor. Is there a vaccine for vent cavities? I've been dealing with tooth decay since childhood. I had sealant on my molars, but they have started to fall off. Should I get them replaced or opt for regular filling?
Vaccine for cavities. Although we have been talking about the vaccine for a long time, we don't have the vaccine available at this time. Although there is a lot of research being done about the vaccine for the cavities. So at this point, it's kind of a little premature to say, or even if you see something on the news, it's very premature. At this point, we do not have vaccines at all. Can you get sealants for your teeth? Absolutely. If it is recommended by your dentist, I absolutely recommend you get sealants to prevent any type of cavities from spreading or getting any bigger. So at this point, I definitely would recommend you get the sealants.
Absolutely. That's really cool. I hadn't heard of that.
Yeah.
Hi, doctor. I don't see any black spots or holes in my teeth, and I have no pain while chewing. However, I feel discomfort only when only eating sour foods. And the sensation lasts almost a day before it completely going away. I don't understand why this is happening. Is this common?
So anytime you see a hole or a black spot or a cavity on a tooth, it is always a dental cavity. So again, without looking into your mouth, I really can't tell why you're hurting. I can only assume that you have a cavity, although you may be thinking that it is a smaller cavity or maybe a just black spot. It may be getting inside into the tooth to the nerve, and that is one of the reasons why you are hurting. So my recommendation would be that it is a simple visit simple visit to a dentist is going to fix that. So when you go to the dentist, not only we look in the mouth, but we also do x-rays or CBCT scans to look at the extensity of the cavity or extensity of the black spot that you're talking about, to understand why the tooth could be hurting. It could be as simple as a small cavity which needs a small fix by doing a small filling, but if you delay it, it may get into like the root of the teeth and you may end up needing some root canal, or if you leave it for too long, then you may end up needing to even lose that tooth. So my recommendation is, when it is early, go see the dentist and get it checked out and get it taken care of as soon as possible.
That's right. And you guys definitely send in your live questions. We definitely want to hear from you all. But we'll keep rolling. I had a dental implant placed a year ago, and now the crown is shaking. When I visited the dentist, they told me that the screw holding the crown is missing and needs to be replaced. However, I never noticed the screw coming out of my mouth, so I'm really worried that I might have swallowed it. How often do dental implant screws need to be replaced? Is there any way to prevent this from happening again?
So the dental implant that we do has three components. One is the metal part that goes into the jawbone, and then there is a what we call it as an abutment, or the connection that needs to go on the top of the implant to hold the tooth that you outside see is in place. So on the abutment, the way that goes into the implant is a tiny little screw that screws the abutment into the implant. So we call it out, we purposely make that screw as the weakest link on the implant, because if anything that we want to break or anything that we want to get loose, and we want the abutment to get loose, and because we don't want to break what we call it as the implant or the fixture, because if you break the implant, you got to have multiple surgeries done to remove the implant and bone grafting, and it's a long procedure. So it is very possible that the screw inside is getting loose, but because of the way it is structured, because of the way it is constructed, there is no way for the screw to completely come out of the abutment or come out of the crown. So it is very possible that you are not seeing the screw coming out, but the abutment is loose. So if your dentist told you that your abutment is loose or the crown is loose because of the loose screw, get it checked out before the implant goes bad. If you leave it too long, then it is definitely going to impact the implant. It is going to impact the bone, and it's going to impact the gum. Matter of fact, real stories happen in my office, and a patient came in yesterday to my office here. This patient had the implant placed like about 10 years ago. One of this front tooth here, she had this loose crown for over 2 years, and she thought like maybe it is a little bit loose, and she completely ignored it, although she had this implant which was stable for over 10 years. So now when she came in, the gum was like all swollen around that one tooth. Most of the areas that she got perfect gums and perfect teeth, that one tooth we have to really go back and do some laser gum treatment and then tighten the abutment and to fix her. And then I have not even seen her because it just happened in my office yesterday. So see, Shai is nodding her head, and she knows which patient I'm talking about. So to going back to your question, so see your dentist, and they should be able to help you.
Perfect. And thank you guys for posting your live questions. I think we'll take the time to go ahead and answer one for you. So let's see here. Hey, Dr. Vadivel, do we need routine gum health checkups with a periodontist, just like a regular dentist visit?
Do we need routine dental gum checkups with periodontist, just like a regular dental visit? When you have periodontal disease or gum disease, you definitely need to have your gums checked and teeth checked. And it's not uncommon for people to ask, hey, whenever they come here to our office to get the gum disease treatment, or do I really need to come back here? We always tell them you need to get your gums checked as well as teeth checked. Not that when you go to the dentist, they are not going to check your gums. But what we do is they focus more on the tooth as opposed to we are focusing more on the gums. So it is better to have your gums checked, or the gums kind of like to have it reevaluated at your periodontist, so that way the gums always stay healthy. And when you come to us as periodontists, and although we specialize on gums and we are not experts on teeth or fillings or cavities, and I'm going to always recommend go back to your dentist to get the cavities checked and make sure that there is no cavity. Vice versa, when you ask them about, is my gum or my gums healthy? Is my gum perfectly healthy? They're going to say, well, you are seeing a periodontist and get that checked out. So a combination of both are going to really help. This is a simple explanation that I give to most of my patients. When you go to your doctor, and when your doctor diagnoses a heart condition, they are going to say that you need to go see a heart doctor or a cardiologist. And When you go to your cardiologist, you can't say, oh, can I skip my doctor visit? When you go to the doctor, you cannot say that, hey, can I skip going to the cardiologist? You need both of them. So same way, you need a dentist and a periodontist.
Absolutely. All right. Well, that was a very good question. Thank you for sending that in, and definitely you guys keep it going. But we'll jump back into our questions that were sent in to us. Hi, doctor. I have discolored teeth and stains on all my teeth due to my smoking habit. I'm planning to get veneers, but I'm wondering, will they also get stained if I continue smoking? If veneers do stain, can the stains be removed with the scaling procedure?
So the simple answer is veneers can get stained from smoking. The teeth get stained, the veneers get stained, and any fillings that you have that may get stained. So you really can't get away with that. To second part of your questions, can we simply remove that with the scaling? Yes, we can, but the challenge is whenever we remove that with the scaler, it is going to leave a scratch on the veneer surface. So whenever patients get veneers, or whenever patients have veneers or crowns on the front of the teeth, particularly on the front teeth, we are very careful whenever we are doing the cleaning, because even a simple scratch can leave a mark on the veneer. So the mark can be removed if it accidentally happens, and we may go back and do a little bit of a polishing. But we can't just use the scaler to remove the stain, and then we can't keep removing a part of the veneer. Sometimes if the stain is not that bad, so what we call it as a polishing the teeth, and a lot of times the polishing can remove the teeth. So again, depending on what do you smoke and what kind of smoke it is, and whether it is mild, moderate, or heavy, your dentist or the hygienist who is taking care of your oral hygiene appointments or the cleaning appointment should be able to answer. But man, just quit, right? The easy solution, right? Not only good for your veneers, but also good for your health. So talk to your dentist. Yeah.
Absolutely. Yes. Alrighty. Hi, doctor. I'm 46 years old. I had 2 primary teeth in the front region, and they fell out a month ago. Since then, the gap between all my teeth has increased. Can I get implants in that area at my age? At 46.
Only 46. Only 46, right? So 40 age is absolutely no bar for implants at all. My oldest patient, this is a story I tell all my patients. My oldest implant patient is 106, and we place patients all the time on older patient. I've placed implants on 80-year-old, 90-year-old, and we do it all the time. So age is absolutely no bar at all. To answer your question, you lost your primary teeth. Yeah, primary teeth, if you held them for until the age of 40, which is great, but at this point, if the primary teeth have fell out and fallen out, then you need a replacement teeth. So the answer would be you need to have some replacement teeth. My recommendation is based on you're also mentioning the gaps, and so I don't know where exactly are the gaps, and if you're just thinking about replacing those primary teeth that fell out, then or the baby teeth that just fell out, can you replace them with the dental implant? Absolutely, you can do that.
Perfect. Very cool. What is the ideal age for jaw surgery? I'm 37 years old, and my lower jaw is positioned forward, which affects my appearance. Is it okay to get the surgery at this age?
66, something happening. Yeah. Sorry, can you repeat the question again, Shai?
Yeah. I can. What is the ideal age for jaw surgery? I'm 37 years old and my lower jaw is positioned forward, which affects my appearance. Is it okay to get the surgery at this age?
So again, there is no bar for any type of jaw surgery at all. At this age, if you're near 37 years old, can you get a jaw surgery done? You can absolutely get the jaw surgery done. Again, depending on the condition, there are multiple steps that you have to go through. So when you think that, or whoever has told you that you needed to have a jaw surgery done, first thing would be that we need to evaluate the teeth to see whether what type of bite you have, bite issues you have. For that, you need to go see who we call it as an orthodontist and the brace specialist, and who will evaluate either the braces can fix the problem. From what you are telling me, that if someone already told you jaw surgery, again you can, when you go back to the orthodontist, they can confirm whether the braces themselves can fix it or you need a combination of braces as well as the jaw surgery. But to answer your question, 37 years old, absolutely it is not old at all. You can definitely get the jaw surgery done.
Absolutely.
Yeah.
I say do it. Alrighty. I had braces treatment 2 years ago and was given a transparent retainer, which I have been wearing regularly. Ever since I started using it, I feel like my gums are shrinking, causing black spaces between my teeth, which makes my smile look unattractive. Should I be worried? Should I stop wearing my retainer?
Do not stop wearing your retainers at any point. So whenever you go to the orthodontist or the dentist who do braces, they're always going to tell you once you wear braces, you're pretty much going to wear the retainers for your life, pretty much. And a lot of orthodontists have retainers programs, and one of the most common reasons why people ask, oh, I lost my retainers and dog ate my retainer, and that's one of the reasons why they say, oh, should I continue to wear my retainers? My answer is absolutely yes. And you have invested time and money to get those beautiful pearly whites, and you want to keep them in tip-top shape and aligned properly. So not wearing the retainers, it is just going to completely relapse and just make the gaps appear in between the teeth. So you definitely need to wear the retainer is the simple answer.
That's
Absolutely,
right.
yeah.
Yes, wear your retainer. I received dental implants 6 months ago. Is there a chance that the implants could worsen TMJ issues? I can feel pain in my I can feel pain right in front of my ear, especially when chewing hard foods. Can the implants be adjusted to prevent them from affecting my jaw?
So can the dental implants worsen your TMJ pain? It may be, the only thing that I can say is like it is a little coincidental. That's what could have happened from what I can say. But it's like I've been doing this for the last about 30 years, and dental implants causing TMJ pain unless you're chewing a lot more than what you used to, just because you got dental implants, so that may be causing some discomfort on the jaw, and or it is very possible now that you got the dental implants and you may be grinding. You used to grind them before without even before you receive the implant. Now that you got some dental implants, you got a mouthful of teeth. Now you're crunching and grinding your teeth, and that may be putting in a lot of pressure in the jaw joint that may be causing the pain also. So the simple answer is, again, go back to your dentist or the dental implantologist or the implant specialist, whoever placed the implant, and then ask them, hey, I never used to have the pain in the TMJ before. Hey, what could have triggered the pain? And then they should be able to do some investigation, look at your bite, or do some CT scans and do other investigations to tell you what exactly possibly could be causing the pain.
All right, and if you're local, come see us.
Yes.
Alrighty, so we'll jump back into the live questions. So taking a look here, and keep sending them in, you guys. Can lasers help with loose teeth caused by gum disease?
Absolutely, laser can help lose to help you prevent losing your teeth from gum disease. And in our office, we do a lot of dental treatment or the dental laser treatment to help prevent the gum disease, and laser helps you with preventing what we call it as a laser bacterial reduction or laser decontamination, or pretty much to prevent any type of infection from happening. Or when the teeth are already infected, we do even either deep cleaning with the laser gum therapy, or we do advanced laser gum therapy. All of these are to help you prevent you from losing your teeth. So whichever part of the world or the country you are in, talk to your dentist about the benefits of the laser gum therapy. They should be able to answer it. And if you happen to be
in our area or in DFW, come see us.
At ToothHQ, and we can definitely help you.
That's right. Alrighty, so we'll jump back into our questions that were sent in, but keep sending in yours because we'll do one more live question before the end. Dr. Vadivel, I recently had my regular dental checkup and cleaning. Since then, I've been brushing twice a day with a new toothbrush. Yesterday, I noticed some kind of gingival growth on the back side of my upper front teeth. There's no pain, but it feels uncomfortable when I talk.
So the gums growing around the back of your tooth, like, sometimes, I've seen it occasionally. It is just the way your gums are, like it's normal, and now you started noticing it just because you went for a dental appointment. That is very possible. Or if you have any crowns or any veneers, and could they be causing any type of irritation to make your gums kind of swollen? It is very possible it can happen. Could that be that you are on some medications and the medications cause some kind of what we call it as a gingival enlargement or the gingival overgrowth? It is very possible. Or could you be going through any type of menstrual period or any type of hormonal issues which could be causing any type of enlargement in the gum tissue? There is a variety of reasons why the gum enlargement or the gum overgrowth could be happening. And again, one more thing I forgot to mention is, you just said you went to the dentist and could there be any type of gum disease, and they tried to mention that you probably did not think it was a priority for you to get that taken care of. If it is, then that could be another reason why the gum disease or the periodontal disease. So no matter what it is, go back and express your concerns to the dentist, and then they should be able to help you.
That's right.
Mm-hmm.
Can a wisdom tooth replace a bad molar? If I lose a molar, can my wisdom tooth be replaced? Could the wisdom teeth be moved to take its place?
Great question. So there was a recent article that came on the scientific journal whether we call it as a tooth transplant, right? So just like whenever you got kidney transplant, when you do a heart transplant or a liver transplant, it is one of the most common questions patients ask us, hey, can you do like a tooth transplant? I'm going to end up losing my wisdom tooth and I'm missing a tooth in the front here. Can I do a tooth transplant to replace that tooth? The answer is no, you really can't do that. I shouldn't say you can't do that. It is very possible that you can do that. And there is a lot of research has been done to replace that, but whether it is worth going through this procedure to get, and are you going to be happy with the results that you are going to get with the heart transplant or the liver transplant? It's a life or death situation. You really can't do anything about it. But when it comes to a tooth and you are getting a tooth, although I don't want to slam dunk it by saying that it is not a life or death situation, but it is critical. You need to get a tooth. But when you are going to get, for example, a front tooth, and the shape of the tooth, as you guys might see, the back tooth is not in the same shape as the front tooth. So you can't really take a back tooth and then put it and try to put it on the front tooth to try and mimic that as a front tooth, and it's just not going to happen. Then you are going to end up grinding the tooth down when you are going to get a veneer, and then the veneer may fail or the crown may fail. Instead, the modern technology has offered dental implants to us, which is a very easy and a very predictable procedure, and one time done. And once you do the implant, if you are going to take care of the implant, and they are going to stay with you for the rest of your life. So speaking of the transplant, would that be worth going through the trouble to do a transplant for your tooth? That possibly not. But can that be done? It is very possible it can be done.
Absolutely. Very futuristic. Really cool question. How close are we to being able to seed a tooth construct within human gum tissue and eventually grow it into a fully formed tooth? Very futuristic questions.
Yeah. So it's kind of piggyback on the last question here. So are we able to remove a tooth from the same person's mouth and then put it in a different spot to make the tooth grow? Yes, it is very possible. We put it inside the gum to make it grow. can you get it from another person's mouth and then put it in the one person's mouth and put it in another person's mouth? The answer is no. You can't really do that, and we haven't gone that far yet. So can that develop in the future, or can there be some kind of a synthetic mixture of like chemicals, because the teeth are made of chemicals, right? So synthetic mixture of chemicals, which can be put in the gum tissue to make a tooth artificially grow. So we are not that far yet. We haven't gone that far yet. Can that happen in the future? I do not see like a lot of research going this way, because the dental implants are a much easier option. You don't have to go reinvent the wheel. These are very predictable replacement tooth option. But can you really go that route of artificially grow a tooth, or naturally grow a tooth in your gum tissue? It's very possible. We are waiting for an answer from the science gurus, I should say.
Yeah. That's right.
Mm-hmm.
Okay, well, you guys are definitely asking some really innovative questions.
You need to move a little bit. I think that's what happened.
Okay. All right. Oh, see, it's like following me. It's sticking to my shirt or something. Okay. Alrighty. So, taking a look here, we're going to jump back into our live questions. Doctor, my dentist is recommending the removal of 4 to 6 teeth, including 3 healthy ones, to make space for dental implants. I really don't want to lose my good teeth. Are there any alternative treatments besides dental implants?
So it is not an uncommon and an unrealistic question, and we completely understand the emotions you may be going through when somebody says, "Oh, you need to get your teeth removed," right? And particularly 3 good teeth removed. Sometimes your teeth may not be as good as you might think, and 3 teeth, like let's say you need to have, for example, all the 14 teeth replaced up on the top, or the 16 teeth replaced, or at least a minimal of 12 teeth replaced on the top. 3 teeth may not be good enough. So are you going to really think that somebody is going to leave the 3 teeth and then reconstruct the rest of the teeth around the 3 possibly okay teeth, or even an okay teeth? Particularly when you're investing that kind of money, and which is going to cost several $1,000s, and you don't want to be taking a risk on just leaving those 3 teeth. And what if those 3 teeth kind of start to break like a couple of years later? So that's why, although it is sometimes good to remove the good teeth and to give you like a completely new smile, it's kind of like, look at this room right here. If you have like a fire damage or a flood damage, and if you are going to reconstruct the whole place, sometime one wall may be good right here, but you completely remove the entire walls and to reconstruct the whole place. It's kind of the same way. So when the 3 teeth may be in good position or good shape, but we recommend that you just get it out of the way and then be done with it.
That's right.
Yeah, it definitely worth your time to remove them and then be done with it. Yeah.
Absolutely. Alrighty, so thank you guys for sending in your live questions. Keep them going, and we'll definitely get to them next time. I'm 40 years old and have artificial teeth, but a few of my natural teeth were stronger a few years ago. My current artificial teeth are very comfortable. Can new teeth be added to my existing denture?
To answer your question, can the teeth be added to your existing denture? Absolutely, we do it all the time. Whether you have what we call it as a partial denture, which is something like this right here, a tiny, or could that be like a regular denture like this, right? You have a complete set of teeth. Or could you have artificial teeth, implant teeth right here, snap-on teeth, or a complete set of dental implant? Whichever tooth breaks from your mouth, we can fix it. So talk to your dentist, whether it is a partial denture or a complete denture or full denture or implant teeth. We can definitely fix them for you.
That's right. Go get your tooth. Alright, Dr. V, when I smile, my gums show more than my teeth, and they appear quite dark. Is there a gum brightening kit available for home use, similar to teeth whitening strips? If professional treatment is the only option, how effective is it?
So the One of the ways that we do the gum whitening treatment is what we call it as a laser gum whitening. So the laser gum whitening is almost like skin resurfacing, if you could imagine, right? We in the plastic surgery world, like they call it as a dermabrasion. So you kind of pretty much scrape off the surface of the skin to have the skin kind of regenerate and then get some live skin and to make the skin appear better. So that is what like needs to happen when you do the gum resurfacing to remove some of the pigments, and it is done with the laser light and it's not done with the chemicals. So if you could imagine, only if you have chemicals, then that can be made available over the counter, then that you can use at home to be able to whiten your gum. So we are not there yet. Could there be a possible future option? Yes, it is possible. At this time, only the gum laser whitening is the only option. In our office we do that, or any office like a periodontal office or an office who does the laser treatment, they should be able to do that and talk to your dentist. To going back to your second part of the question, how effective it is, and depending on how dark your gum pigmentation is. And so if your pigmentation is very, very dark, and you may need just one treatment and it may be all said and done. Or if you have dark pigmentation, you may need 2 or 3 appointments to remove the dark pigmentation. Sometime occasionally we also see that the once you remove the pigmentation, it tends to reappear and again go back, and we use a laser to recorrect it. And if it is one area, we just kind of just go into that one area to correct it, or if it appears all around, we go back and redo the treatment to correct that. So to answer your question, it is absolutely very effective. Talk to a laser dentist and then they should be able to help you.
Absolutely. Alrighty, let's keep it going. Why is a front tooth cap more expensive than a back tooth cap? We chew mostly with our back teeth, so why is the cost higher for the front?
So the front tooth, you smile, and then that is like an aesthetic zone right there, and there is a lot of technique involved, and then there is a lot of material changes involved. And back tooth is just like it's like a one solid material, and even if you're like slightly off on the shade, you're not going to be able to find out, particularly on the bottom teeth. Nobody even is going to be able to look at the bottom teeth on the back. On the top, like you may be sometime able to see when you smile really big, but even if the color shade is like slightly off, nobody is going to be able to notice. But what if it's like slightly off on the front tooth? How many, if we live in this selfie world, right? So whenever we take pictures, and so we are going to start to notice, there is some change in color of the front tooth, and you're going to start to notice. So that's why as dentists, we take extra caution whenever we are building the front teeth, and we use special materials. And also, we do sometimes what we call it as a custom shading. What that means is we either send you to like under specific light situation. For example, this white light that I have, when you look at the tooth, it may be okay, but when you look at under like the dark light, it may be a completely different situation. So whenever it's not the tooth material which appears to be the same, but the material have a different kind of shades or a hue under different lights, and that's why it is critical to match the shade of the tooth to as specific or as close to the tooth as possible without any changes in different kind of a light situation. So that's why the materials we use and the techniques that we use and the extra precautions that we need to do, and the extra appointments that you will need, and we may have to bring some extra lab materials to fix those shades and such. And that is the reason why the front teeth cost a little bit more as compared to the back teeth.
Sounds valid to me. Alrighty. I recently underwent root canal treatment and my mouth was filled with blood. Do the nerves of teeth contain a large amount of blood? I was previously diagnosed with anemia, and I'm concerned this could make it worse.
So losing just a little bit of blood from a root canal, I don't think it is a cause for concern. about anemia. So I don't think there is anything you need to be concerned about unless you lose like a large amount of blood, and which is it's almost uncommon or almost impossible for you to lose that much of blood to the degree that you are going to be concerned about your anemia. But can you see some can you see some blood on the tooth after undergoing root canal therapy? It is very possible. Either the blood might have come out from inside the tooth, which is uncommon, but more than likely it is very possible the clamp that they used around whenever they are doing the root canal, or instruments they use whenever you are getting the root canal done, it is very possible that made the blood appear on the top of the tooth or around the tooth, which I'm more than likely thinking that might have caused the blood to appear. So the answer is nothing you need to be concerned about. And if you're getting constant bleeding, and if you're starting to notice constant bleeding on the bleeding appearing on the top of the tooth or even around the tooth, and if it is a continuous process, then I would recommend you get it checked with your dentist.
That's right. Okay, you guys, we're getting close to an end. Hi, doctor. What are the benefits and risk of coffee for dental health?
Some might say the coffee is bad for teeth, or most might say, the dentist might say coffee is bad because it is going to cause staining of your teeth. On the contrary, coffee is good for your teeth also, because coffee is very rich on antioxidants, which your body really needs, and coffee has some antimicrobial properties, because when you have bad bacteria, then you just like using a mouthwash, and if you want to kill some of those bad bacteria, coffee will help you kill some of those bad bacteria also. And then coffee has some anti-inflammatory properties, and particularly when you have gum disease around your mouth and or some kind of an inflammation or gingivitis, and the coffee can help the gums with the anti-inflammatory properties, so it can help resolve help or get the gum disease or the gingivitis under control. So the real answer is, for these three benefits, the antioxidant properties, antimicrobial properties, and the anti-inflammatory properties, yes, coffee could be a good thing, but again, in moderation. Anything in moderation, right? It's kind of like red wine is good for health, but you need to be in moderation. The same way, coffee is good for your health, but my recommendation is good for in moderation. That way you don't stain your teeth, and then or particularly if you have any dental restoration, you don't want to drink a lot of coffee to the degree it is going to stain your teeth so bad and you can't even get those stains removed. So coffee is good, but again, in moderation. And
all right, are we keeping it going?
No, I think we are good. Yeah.
All right.
Well, thank you all for joining another great show, and we look forward to joining you guys next time. And see you all. Thank you very much.